A new study has found a strong link between vitamin deficiencies and an increased risk of dementia in adults. Researchers say poor nutrition, especially low levels of key vitamins, may significantly raise the likelihood of developing dementia later in life. The study was carried out by researchers from ICMR National Institute of Nutrition in Hyderabad in collaboration with scientists from Stanford University, Karolinska Institute, Imperial College London and the University of Eastern Finland as part of the Worldwide Fingers Network on Dementia Prevention. Published in the Lancet Regional Health Southeast Asia, the study highlights the need for early screening and nutrition-focused interventions to support healthy brain aging in India. The study covered 556 middle-aged and older adults from rural and urban Telangana between 2023 and 2024. Using the dementia risk score, researchers found nearly 39% were at high risk of developing dementia later in life. The study identified widespread micronutrient deficiencies, with vitamin B2 deficiency was found in 64% of participants, vitamin D deficiency in 42% and vitamin B6 deficiency in 34%. Those at higher risk also showed lower levels of vitamin D, B2, B6, folate and B12. Researchers say deficiencies of vitamins may contribute to higher dementia risk, particularly among rural populations and women. Dr. Bhanu Prakash Reddy, scientist at ICMR National Institute of Nutrition and lead investigator of the study, said the findings highlight the need for early dementia risk screening and nutrition-focused interventions in India.
Many of the people who are at risk for dementia also have lower levels of vitamins in their blood, as well as their dietary intake is low. And even their dietary diversity score is also low in the people who are at risk for developing dementia. And also their consumption of bakery items, saturated fatty acid related products are higher in the people who have at risk for developing dementia.
The study also found major rural-urban differences. Adults living in rural areas had a much higher predicted dementia risk compared to urban participants. Factors such as lower education levels, hypertension, poor diet, and vitamin deficiencies contributed to increased vulnerability. Researchers found that participants with higher risk consumed fewer fruits, vegetables, dairy products, nuts, and healthy fats, while eating more processed foods and saturated fats.
There is no proper treatment once the dementia is diagnosed. By the time dementia is diagnosed for any person, that there is very little that we can do to treat that. Literally, we can just manage that. So now we are focusing on how we can assess the dementia this prior in their midlife, so that they will not reach to the proper dementia stage, which is a critical stage.
Researchers say the study is among the first in India to combine blood vitamin analysis, dietary patterns, and dementia risk assessment in a single population. They emphasize that improving nutrition, controlling blood pressure, and promoting healthier lifestyles could significantly reduce the future burden of dementia, especially as India's elderly population is projected to rise sharply by 2050.